Hey guys, I'm going to go over our port access. Again, it's been a few years since we've had a training on this. So I want to show you what supplies that I use here first. These are our PowerLock kits that we have up in our med room currently. They come with almost all the supplies you need. They should have a sterile flush on the back that is attached to it. They do fall off quite a bit, so there are extra sterile flushes behind the door in the med room. These are not sterile flushes. I usually do grab a few of these as well, but these are not sterile. These are. Okay, so make sure that you know that one is and one isn't. You cannot use these non-sterile flushes on your sterile field when you are accessing a port. There are a few different types of ports that we work with. Most of them are going to be like a single port. This is an older one. It just means that there's one area to access here. Occasionally you will run into one that has two ports right next to each other, or even three. That's pretty rare, but it is possible. If they have the little bumps that you can palpate, or if it was placed here at Mercy, we know it is a power port in which we can power inject for things like CT for PE. Other older ports like this one here are probably not power injectable. Just like when they have a pacemaker, they should have a card with that information on it, hopefully. So there are a few different ports you may run into. They all operate pretty much the same way. I'm gonna put my chest back on here. I would ask the patient if they know what size of needle that they use before I go into it. If they don't, if they have no idea, it's probably just the standard size that comes with the kits. That is a 20 gauge 1-inch needle. We do have different sizes of needles. They are in the med room up by where these kits are stored. But I only grab a different size if they know they use a longer or shorter needle. Kind of depends on how much tissue they have overlying that port. So make sure that your patient's ready. Some of them will come in with the numbing gel or cream on top of the port already. They have that at home. That's great. We just need to wipe it off and clean it first. I make sure that they are prepared. They have their gown on and down, and they are sitting in a position. I usually don't have them lay flat just because then all of that tissue kind of bunches up over that port. I do have them sitting up at about 45-degree angle. You'll see what's comfortable for you. Making sure everything's out of the way so I can clean and keep it clean while I'm doing the procedure. I do mask myself. There is a mask that comes in this kit that I'll show you. I typically mask the patient. Some patients say that they don't want to wear a mask. That's fine. I guess that's up to them, but I try not to have them breathing directly on it. If there's anybody staying in the room with you, like family members or friends, then they can either step out of the room or they can be masked as well while we're doing this. So you are setting up a sterile field here. I'm going to open my kit here. Hopefully you can see what I'm doing. I'm going to grab my mask here. And of course, before you would start this, you would wash your hands as well. I'm going to take this mask off just so you can hear me talk better while I'm doing this. I would also put on my sterile gloves as well. And with my gloves sterile, I would open up, here is my Huber needle that comes in the kit. I would open this up and dump it out on my field. I had taken my sterile flush off. I would open this up and dump that on my field as well. Here is another drape that if the patient is sitting in such a position, I could cover them as well. I'm knocking stuff all over here. And then I would typically take this time to clean using my ChloraPrep, in which I can go back and forth and all around, like so. And then you want to let it dry completely before you touch it again. During this time, I would change to my next pair of sterile gloves here. And at that point, I'm going to prep all of my things here. So you'll notice these Huber needles have 2 ports on them. I didn't at the beginning dump, which I'm going to do now. So if I had to do this, I would take off my sterile gloves and dump my access ports here on my sterile field as well, so that I had them to get ready. If you did what I did, you could call somebody in the room and have them do it for you. But I'm going to flush these and attach these to my Huber needle and flush. You cannot leave these white caps on. They are perforated. They can allow air in, which is why we use ports on both of these here. All right. So it's all flushed, capped, and ready to go now. My area has dried. Put on a new pair of sterile gloves. I prefer to hold the port with my 2 fingers, and then I'm pretty shaky, so I will use my pinky to stabilize. I'm gonna find it here. They are pretty well secured most of the time, but they're secured on the inside with sutures, so sometimes those rip if people don't take it out carefully. So it may be a little more movable. You're going at, there's a cap on the needle you'll have to take off. I'm trying to do this so you can see me here. You're going at a 90-degree angle right into the center of the port. So we're gonna count to 3, 1, 2, 3, straight in. That felt like it went in pretty well. And then it should flush pretty easily. If it doesn't, you can do your push, pause, push, pause, push, pause. Some people know they never get blood back with their port. Ideally, we would get blood back. We would be able to collect samples from it, except for any coagulation labs, you should not be collecting off of the port because we do flush it with heparin. So if you don't get blood back, it doesn't mean you can't necessarily not use the port for infusions. You're watching for signs and symptoms of infiltration, any swelling, pain, irritation around the site of the port as well. So if it does flush, and it flushes pretty easily, you can still use that while they're in the ER, even if you don't get blood back. So at that time, we are going to stabilize it and tape with our Tegaderm here. I've seen people put gauze underneath the wings to make it a little more stable and tip less. Short term, that's probably okay if it's the sterile gauze from your kit. However, long term, if that gets wet, it just is a breeding ground for bacteria. So I don't really like to put anything extra under there. If you are drawing labs, you do need to pull back a waste of 10 milliliters. And if you flushed it with your sterile flush, you can just use that same thing to pull back the blood. You should be using this frequently while it is accessed. If not, you need to use a heparin flush while it is stagnant or while you're not using it, so that it doesn't clot off in the port. If they have a double or a triple port, like I talked about earlier, you can actually use separate needles to access all of those ports separately and run completely incompatible medications through them, which is very nice. I usually take these extra stickers here and secure it a little bit more. I usually tag it so that it is pretty accessible out the top of their gown there, and you can use the other extra ones to help secure around where maybe the Tegaderm isn't securing as well down at the bottom. So flush and clamp. Make sure again you have the Heplock ports at all of the ports here. We don't leave those white caps on so that we don't risk getting an air embolism or any kind of infection. When you are done, we don't typically discharge patients with these ports accessed. If they're being admitted, great, you can leave it accessed. But if they're being discharged, it really is up to the doctor, but typically we're going to take them out. It's not really a complicated procedure. You're gonna flush it with saline. You don't have to use a sterile flush after it's accessed. And then you're going to use our heparin flushes in the IV flush guideline set to flush it last. The heparin is what you want in there last because we want it sitting in that port, in that cavity, the empty cavity, so it doesn't clot off. So once we flushed it, most of the time, once you remove it, you just need a Band-Aid over the top, and the patients will know this. So I'm going to undo all of my tape and securing, I'm going to be wearing gloves. And this Tegaderm likes to stick really well to this mannequin. And I'm taking the skin off here. Okay. It never sticks to humans that well. So when we go to DC this, we are going to take our gloved hand and you're going to hold the wings here and you're going to stabilize the port and then pull straight out. The safety lock will engage once you push on these clear wings. We want to stabilize that port so we don't rip those sutures out that are holding it in. It makes it a lot more difficult to access for the next person. And then it doesn't bleed like an IV site. You may get just a little drop of blood on the top here. A Band-Aid should suffice. Throw this in your sharps and clean up your mess and you're good to go.